My name is Katie Greenland. I work in the Environmental Health Group at London School. Most of my research is actually on behaviour change for diarrheal disease and control of diarrhoea, but more recently we've been working on trachoma. So I want to just take a step back from behaviour change and think, how do we actually get to the interventions that we want to implement, and to tell you a little bit about the formative research that we've done in Oromia, Ethiopia. We did 2 studies, one in January in the dry season this year, and another one in the summer in July, which was conducted by a master's student, and she had the pleasures of working in the rainy season. So, as many of you are probably aware, the heaviest burden for trachoma is in Ethiopia. 75 million people are at risk, and implementation of the SAFE strategy is what's recommended. That's surgery, antibiotics, facial cleanliness, and environmental change and environmental improvement. But actually, most of the interventions are around surgery and antibiotics. A lot less is done on the F and the E components. It's hard to change behaviour, and also there's a lack of high-quality data on which interventions should actually be implemented, and a lot of formative research is not actually done before behaviour change interventions are rolled out. So that means we have a limited ability to design sustainable, contextually relevant, and actually theory-based trachoma interventions, meaning that the interventions that we implement are actually based on how we think we can change behaviour and the determinants of those behaviour. And this impedes progress towards the 2020 elimination targets for trachoma. So our study had 4 aims. We wanted to document where and when our behaviours of interest, which I'll talk about on the next slide, occur, and who carried them out, to identify the suboptimal practices. We wanted to investigate drivers of the key behaviours and factors inhibiting these practices, study whether there were differences in behaviours across the 2 seasons, and explore community perceptions of potential intervention strategies. Now, I only have 10 minutes, so I'm going to focus just on the first and the third objectives here, so really just describing the behaviours that we saw and the differences between the seasons. So what behaviours were we interested in? We actually drew these pictures in the community when we were trying to understand what people knew about trachoma. If it's spreading from eye to eye, we have to think, how does it get there? And we don't actually have a lot of good evidence for some of the transmission rates. Obviously, hands can be one route, so we're interested in hands. And when we think about flies as well, that's because the flies seek the eye, which means we're interested in feces in the environment and also sanitation practices in general, as well as animals and garbage. That's because these flies breed in human feces. Also interested in fomites and things that people can use to rub their eyes. So, for example, how do people sleep? What are the sleeping arrangements? What do they do with their bedding? How close are they when they're sleeping? What are they doing? Are they wiping young children's faces with their clothing? Are they washing clothes regularly? And of course, the key one, which comes much earlier and could potentially be the most important intervention, the face washing. So we were working in Warajaso, which is an area with high active trachoma prevalence, between 30 and 50% in this area, and it was a very rural setting. In both of our studies, we conducted observation. That's always our starting point when we're thinking about behaviour and understanding it. You'll notice that the numbers here are small. That's because this is formative research, so it's really more exploratory than trying to make big generalisations. We worked in 5 different communities. We were more interested in how practices differed between communities, because from past studies we've seen that within a community people tend to behave quite similarly across households. And we wanted households with children younger than 3 years of age. We conducted post-observation interviews in those households that we observed to understand more about the behaviours we'd seen. And in both studies we did some focus group discussions and key informant interviews to put everything into context a little bit more. Our methods were guided by a theory about behaviour, the behaviour-centred design approach, which was developed at the London School. It's actually a framework for intervention design and evaluation, and it has a behaviour theory model as part of that. So the households that we observed, we were able to go to 7 of the 10 households in the rainy season study that were observed in the initial dry season study. Now there's always something going on whatever time you connect with a community. In the dry season, there was a festival coming shortly afterwards, which we need to bear in mind for interpreting the behaviours that we saw. And again, in the rainy season, that was during the school holidays, which was deliberate. We wanted to see if we saw a difference there when the children were not in school. 5 of the 10 households in the rainy season, the second study, had latrines, and nearly all of them, 9 out of 10, had soap in the households. Quite a range of households, but they tended to be like this picture on the top here, quite well-kept fences. In a lot of rural communities, people live quite scattered, but here, really, you can't see what's going on in the neighbouring compounds. So it's not sort of the behaviours really publicly taking place in the home, as it can be in other areas. And so that's something that we thought we can't really use, is to say, look, everyone can see what you're doing, and therefore make it more kind of socially unacceptable to perform certain behaviours. Yeah, so you can see the latrines there, we'll come back to that. But the houses really tended to be very simple structures. In the bottom picture, you can see that often the fire was in the same room as where everyone was sleeping, the animals in the same room as well. So this is in the dry season. You can see the very long queue at the water point. I was there and waited a very long time, over an hour, for our collection of water. And the little girl in my household, her jerry can was right at the front of this queue. It was just the water pressure was so low, and it still took a really long time for the 2 or 3 people in front of us. But when we came to the rainy season study, naturally, as you might expect, people were also collecting rainwater. What I thought that would mean is that they would therefore have more water in the household at that time of year. But no, they actually just collected less water from other sources. So they had very similar amount of water in the households, they just changed the source. This is actually the same water point in this picture here as in the one above it. And you can see there's no queue at all here for water compared to the previous study. Sanitation. I said 5 of the 10 households had latrines. I don't know whether I can really say that, because this is what they looked like. They were clearly not in use. Many of them had been recently constructed. That's because there was threat of a fine if they didn't do so. Again, not surprising to many of you here, see some noise. And no real superstructure. There were reports that some of these latrines collapsed in the rainy season, but our student didn't see that, but she heard that in the communities. This is actually at a local school. You can see this is the sink, the holes there where the water should be, but there wasn't water, and that's feces there in the sink. I will spare you the image of the photo of the actual latrine. And in the households as well, open defecation was very common for everyone, but young children were allowed to defecate anywhere. This is right next to the dwelling structure. At certain times of year, like when there were crops on the fields, people would alter where they defecated. They wouldn't defecate in the same part of the field during the rainy season when our student was there, as they said they would in the dry season. But generally, people are not using the latrines that are there, and it's very much an open defecation environment. And of course, a lot of flies everywhere, particularly on the children, which is why, as well, we're seeing that we are working in a highly endemic trachoma area. So, face washing. It usually took place as part of a routine of washing other parts of the body, as you can see here. This was in the dry season, so this little girl washed her feet, her hands, her arms, and her face with soap quite thoroughly before going to school. Now, people didn't know we were coming to do the study in advance or exactly what it was we were looking at, and these were the behaviours that we were seeing. So we do believe that this is actually what was happening and wasn't put on for our benefit. Children also helped each other, but actually in the rainy season study, we didn't see bathing of young children. This was really something that was taking place much more in the dry season. Hands were also washed, but again, just after this child had eaten, and not much hand washing taking place. You can see the small amount of water that is used. Water was very much conserved for all of these activities. Now, what was interesting was that within a household, one child might wash their face with soap, another child might not wash their face, and there was no sort of pattern in behaviour between households. Also, during the rainy season study when the children were out of school, there was a lot less face washing going on. So that's something that was really associated with the children going to school. During the dry season study right before the festival, laundry was observed in a couple of households, but usually this happens down at the river, and very infrequently because it requires taking everything to the river. That's because of water scarcity, and it's much easier to take things to the river than to bring the amount of water that's needed to wash clothing up to the household. On the right-hand side here, you can see the small amount of water that's used just to wash the baby's clothing, but that was one of the few things. And actually, we didn't see people at all drying themselves after washing their faces, so we don't need to worry about potential fomites there. People weren't wiping children's faces at all, which surprised me because we did a similar study in Turkana in Kenya, where every few seconds people were wiping discharge away from children's faces, and we just didn't see that here at all. People just left it. They barely touched the children's faces. People did sleep very, very closely together. We actually mapped it for each of the households, and they would often share one blanket. Although we don't know, of course, how important this might be in the transmission of trachoma, it does show us if we are thinking of potential interventions. On the bottom right-hand corner here, you see they would roll up some old clothing that they would use as a pillow, and we thought perhaps that could be important if people are sleeping very closely together. But that pillow is actually put underneath that straw mat. So again, if you want to do anything to try and change those behaviours, it's a lot more complicated, because it's not that the pillow is something you could just wipe down or that you could try and put different pillows for different people. And again, the young children very much are always with the mother, so you always do see that pattern of behaviour. Some older children might sleep separately, but still usually in the same sleeping space. So, there's a long list of things that you can think of once you've done formative research study and you start to think of all of the different potential solutions. Here, sanitation promotion is really important. Actually, there's possibly some damage that's been done with the work that's been done already on sanitation and the fact that people have been forced to build latrines that they're clearly not using. We would also think that there should be a lot more work done in schools. And there's a lot of other things we could do based on what I haven't presented so much on here, that some of the drivers of behaviour, such as building on the existing routines or trying to heighten the extent of disgust that's felt around discharge to try and encourage washing of hands and wiping of children's faces. But one of the key things that we really need to do, and what's actually the next stage, is to understand better transmission and which interventions might be the most important. So the next phase of work is actually going to be looking a little bit more at transmission routes and doing some fly studies and looking at where chlamydia is actually found in this environment in relation to the behaviours. And then we will be moving on from there. So there's a bit of a gap between formative research and an intervention. You can't just say these are the findings and then we create a program, because you can know some of the things that might be driving behaviour, but that's not then what you have to do to get to the behaviour change. And that's why we use the behaviour-centred design approach as our model for creating the intervention. We have a full report, but also a 3-page summary of this, which you can find on our website if you're interested to know more about the rest of the findings. So that's, if you don't have time to write it down, EHD Environmental Health Group and London School Trachoma, and you should be able to find it. So, yeah, thank you from the rest of my colleagues as well. Thank you.